This medication is a combination of oyster shell and vitamin D. It is used to prevent or treat low blood calcium levels in people who don't get enough calcium from their diets. It can also be used to treat conditions caused by low calcium levels, such as bone loss, weak bones, decreased activity of the parathyroid gland, and certain muscle diseases. Calcium is crucial for the normal functioning of nerves, cells, muscles, and bones. Vitamin D helps the body absorb calcium and phosphorus, which are important for building and maintaining strong bones. When taking oyster shell plus D, be sure to take it with food, or as directed by your doctor. If your daily dose is more than 600 mg, divide it and take it throughout the day for best absorption. If you're using the liquid form, use a special measuring device to measure the dose. If you're taking the chewable form, chew thoroughly before swallowing. And if you're taking capsules, swallow them whole. Do not crush or chew extended-release tablets. Take this medication regularly at the same time each day to get the most benefit from it. And if your doctor has recommended a special diet, be sure to follow it. Be cautious about taking other supplements or vitamins unless ordered by your doctor. If you think you have a serious medical problem, seek medical help immediately. If you experience constipation or stomach upset, make sure to talk to your doctor or pharmacist. Your doctor has determined that the benefits of this medication outweigh the potential risks. However, be sure to contact your doctor if you experience any serious side effects such as nausea, vomiting, or changes in mood. It's important to seek medical help if you notice any symptoms of a serious allergic reaction, like rash, swelling, or trouble breathing. And remember, if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies, including allergies to other vitamin D products. This product may also contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, low levels of stomach acid or bile, or an untreated phosphate imbalance. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. And if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar or aspartame, be sure to ask your doctor or pharmacist about using this product safely. The interaction of oyster shell with other drugs can affect how these medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with oyster shell plus D include digoxin and phosphate binders. Calcium can decrease the absorption of other drugs such as tetracycline antibiotics, bisphosphonates, estromostine, levothyroxine, and quinolone antibiotics. Also, certain medications can decrease the absorption of vitamin D. It's important to separate your doses of these medications from your doses of calcium/vitamin D. Check the labels on all your prescription and non-prescription/herbal products for calcium, phosphate, and vitamin D content, and ask your pharmacist about using those products safely. It's also important to avoid using medications containing calcitriol while using vitamin D, as they are very similar. This product may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this product. If someone has taken too much oyster shell plus D and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mental or mood, headache, drowsiness, weakness, and tiredness. Make sure to schedule regular medical tests, like checking your calcium levels, while you're taking oyster shell plus D. It's important to keep all your medical and lab appointments. And don't forget to talk to your doctor for more information. You can also get vitamin D from foods like fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. And your body can make vitamin D when you spend time in the sun. For calcium, you can find it in dairy products, dark green leafy vegetables like broccoli and spinach, and calcium-fortified foods like orange juice. To reduce your risk of bone disease, try to stay physically active, avoid smoking, and limit your alcohol and caffeine intake. If you forget to take a dose, take it when you remember. If it's almost time for your next dose, skip the one you missed and take the next one at your regular time. Don't take 2 doses to make up for the missed one. When storing oyster shell plus D, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that is not the bathroom and out of reach of children and pets. When it comes to getting rid of this medication, avoid flushing it down the toilet or pouring it into a drain unless specifically told to do so. Instead, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.